Do you need help with marketing, new clients, or online reviews? Massage Book is your solution, streamlining all the challenging aspects of your massage therapy practice. This powerful software simplifies scheduling, payments, and marketing, allowing you to focus on what you do best, helping clients live better. Plus, sign up now with code ABMP50 and get $50 off after your free 30-day trial. Visit massagebook.com, create an account, and transform your practice today. That's Massage Book with code ABMP50 for $50 off. Don't wait. Give it a shot today. Are you looking for a company that empowers your growth and development? Look no further than the Elements Massage brand, where all massage therapists have the opportunity to thrive through the Elements Massage Career Advancement Program. In the Elements Massage Career Advancement Program, Elements Massage Studios recognize, reward, and uplift their massage therapists, rewarding continuous learning, commitment, and growth. The Elements Massage Career Advancement Program includes professional, elite, and master levels, where massage therapists will enjoy higher commission rates, access to continuing education and development opportunities, and unique career growth opportunities to propel them toward a successful future. Evaluate your career and apply to an Elements Massage studio today. Visit elementsmassage.com/careers and take the first step towards a fulfilling journey. That's elementsmassage.com/careers.
Hi, and welcome to I Have a Client Who, Pathology Conversations with Ruth Werner, the podcast where I will discuss your real-life stories about clients with conditions that are perplexing or confusing. I'm Ruth Werner, author of A Massage Therapist's Guide to Pathology, and I have spent decades studying, writing about, and teaching about where massage therapy intersects with diseases and conditions that might limit our clients' health. We almost always have something good to offer, even with our most challenged clients, but we need to figure out a way to do that safely, effectively, and within our scope of practice. And sometimes, as we have all learned, that is harder than it looks. Today's I Have a Client Who story is not a current one. It comes from a memory about a client that an attendee had during a webinar that I gave recently. That person gave me permission to share, and their story goes like this. I had a client who was in their late 50s, early 60s, and they had a history of an aortic aneurysm. He'd had surgery to fix it, which resulted in grafts in the iliac arteries. About 1 to 2 years after the surgery, he came in to get a massage. At this point, I've been massaging him for about 9 months, and I was 21 years old. And he had severe leg pain on the left leg. I recommended that he go to his doctor's office and not get a massage, but he refused. I decided to do a light massage on him and use that time to encourage him to go to his physician. We discussed possible scenarios of the pain, like activities he'd been doing. I don't recall if his leg felt hot or looked swollen at all. But by the end of the 60 minutes, I managed to get him to promise me that he would call his surgeon. Well, that is an alarming story, but I'll give you a spoiler alert and go ahead and tell you that it all ended well, and we'll come back to that in a bit. But first, let's try and figure out what happened here. We'll learn a little bit about iliac artery grafts for aortic aneurysm, and then we will look at iliac artery graft failures. We all know what an aortic aneurysm is. Yes, it's a widening and weakening of the aorta somewhere. This problem has a different numerical rating depending on its location on the aorta. And if this bulge ruptures, that means the person will bleed to death internally, and that can happen really fast, which is why it's so important to stay on top of these and repair them if that's possible. This story sounds, to me at least, like maybe the surgeon used pieces of the iliac artery to replace a section of the bulging aorta, but that turns out not to be the case. The use of Dacron grafts, these are tubes made of polyester fibers to repair damaged arteries, began in 1958, and the process has been refined and updated over the years. Different procedures and devices are used depending on where the aneurysm is. We don't have all the information for this client, but we do know, according to the story, that his surgery probably happened sometime in the late 1990s or very early 2000s. That seems like yesterday to me, but it turns out to be a really long time ago in terms of surgical interventions. Today, most aneurysm repairs are done through endovascular approaches. This means an instrument is threaded up the iliac artery to the site of the weak spot, and a graft, that Dacron tube that has special openings to allow blood to flow to all the organs that are supposed to be supplied by that key section of the aorta, that is installed. This is called an EVAR surgery for endovascular aneurysm repair. It's just a guess, but from this contributor's description, I'm pretty sure that this client had an EVAR surgery. As you can imagine, the survival rate from a surgery like this is much higher than we would expect to see with open thoracic surgery. That said, it is still a risky procedure, but it's a lot better than simply hoping for the best with an untreated and unstable aortic aneurysm. It's useful to understand that endovascular surgery for aortic aneurysm is a relatively recent innovation. And for our client, who probably got his surgery around the year 2000, it was really, really new. The first such procedure in the United States was done in 1988, just 11 years previous. So what's all this then about the iliac arteries? How do they get involved in this? Well, it turns out that when an aneurysm is low in the aorta, when it's an abdominal aortic aneurysm, this can extend to involve the iliac arteries as well. And this happens so often that they make special grafts that are designed to support both the abdominal aorta and the proximal portions of the iliac arteries. So my educated guess is that he had one of these special devices implanted, and that speaks to the involvement of his iliac arteries. And this then leads us to the next question. What in the world happened to his leg? We know that he had a sudden onset of leg pain about 2 years after his surgery to correct an aortic aneurysm, but we don't know much more than that. The massage therapist can't remember if his leg was swollen or discolored, but they were alarmed enough to request that he delay his appointment to see his doctor, and the client refused. That's a bit of a different issue, and we'll come back to that in a little bit. So the massage therapist decided to change their massage technique and to work hard to persuade that person to call his surgeon. Well, it turns out that even EVAR surgeries, which can involve inserting a stent or graft into any section of the aorta, not just where it bifurcates into the iliac arteries, EVAR surgeries do indeed have some common complications. But these post-surgical problems can usually be corrected. These can include things like not sealing completely so that blood continues to accumulate in the aneurysm sac, and that can eventually rupture. Or the device can develop a kink, or it can become blocked or infected. Or the device can migrate, which allows blood to escape. I will go out on a limb and suggest that maybe this is what happened for this client. If this person had neglected that leg pain, or if he had delayed in calling his surgeon, it is quite possible that he could have died. It is not an exaggeration in this situation to say that his massage therapist may have saved his life. Now, I want to come back to an earlier point. Let's look again at the way our contributor described the conversation they had. They said, about 1 to 2 years after the surgery, he came in to get a massage. At this point, I'd been massaging him for about 9 months. I was 21 years old. He had severe leg pain on the left leg. I recommended that he go to his doctor's office and not get a massage, but he refused. Okay, Put yourself in this situation. You're 21 years old, probably not in practice for a very long time. Your client, a man in his late 50s or early 60s, has an alarming symptom, new severe leg pain. So you want to delay his session until he has seen his doctor, and he says no. Well, there are some really interesting power dynamics in that, aren't there? The massage therapist could have said, yeah, I'm not going to work with you until you have this looked at, and that would have been a perfectly reasonable decision. But for a variety of reasons, that's not what happened. Instead, the massage therapist found a workaround, very light massage that the client was willing to accept, and persistent encouragement for that person to call their surgeon. And here's what happened. Lo and behold, he called and was asked to come in immediately. He received a vascular ultrasound where they found that the graft detached from the iliac artery and blood was pooling in his leg, causing him pain. Needless to say, that freaked me out. So many things could have gone wrong. We went on to have a 12-year massage relationship, and I worked on him until he passed away peacefully in his bed in June of 2012. Well, that is a very satisfying story. Frustrating, of course, because the client was so resistant to seeing a doctor for this unusual leg pain. We don't know the reasons. Maybe he didn't like his doctor. Maybe he just wasn't that worried about his leg pain. Maybe he didn't take his massage therapist's concerns seriously. Or maybe he was worried about his insurance and how to pay for another doctor visit. A couple of days ago, I had a conversation with a registered massage therapist from Ontario, Canada. And in his work, which specializes in musculoskeletal issues, massage is much more closely integrated into the medical model. When he has concerns about unusual leg pain, for instance, it is not considered strange for him to simply delay treatment until a client has had an ultrasound, just to rule out worst-case scenarios. His clients are typically compliant and willing, which is a reflection of a few things, including the therapist's self-confidence in saying, yeah, we're not going to work together until we know more about your leg pain, and the function of a healthcare system that's a little easier to navigate than ours. So what about the massage therapist in our story? Were they wrong to proceed with the massage? Should they have made a different decision? Well, hindsight is always 20/20. And we can understand how a young new therapist who's dealing with an older client who has a complex health history might be hesitant to simply refuse to do a session. In my opinion, this therapist did the best thing possible under those circumstances. They figured out a way to work so that they could minimize the risk of a problem, and they used their time and influence to convince this client to call his surgeon. Bravo, I say. But I'm guessing if such a thing happened again, now more than 20 years later, this therapist would probably feel more able to say something like, for your safety and mine, we cannot proceed until we get more information. Let me know as soon as you find out what's going on so we can make another appointment. I applaud this young massage therapist and the more seasoned among us for keeping our clients' safety and well-being at the forefront of our decisions. And I'm very honored to be a support resource for that process.
Anatomy Trains will be holding our flagship Anatomy Trains Structural Integration ATSI training in beautiful Vancouver starting September 16th, 2024. Progressively build your anatomical knowledge, hands-on manual therapy techniques, and most importantly, seeing and understanding postural patterns and developing strategies tailored to individual needs. We warmly invite you to apply today and bring your bodywork career to the next level. Visit anatomytrains.com for more.